All right. Hello, R. Weasley. My name is Haley, and I'm going to be going over some of your vitals and your lab values today.
Okay.
So to start off with your vitals, your heart rate was a little elevated, just meaning that your heart was beating faster than it normally is, and it could be due to the recent trauma or stress that you've experienced. Your blood pressure was high, so we just need to keep monitoring that so we can assess for hypertension, and that can be evaluated just to see if there's any risk for heart attack or anything like that. Your SpO2, which is just your oxygen, it was decreased, so you may have some shortness of breath, especially when we do get you up in PT. And then your MAP, which is mean arterial pressure, that was high, which just means that it increases the demand on your heart for your heart to work, so it can increase the risk for heart attack and stroke. Okay, for your lab values, some of them I wanted to talk about was like potassium, which yours was kind of close to the lower end, but it was not out of the critical range, or in the critical range. But since it was lower, you might experience some life-threatening arrhythmias, which are just irregular heart beats, and it can decrease the cardiac muscle contractility. And then your creatinine was high, so the higher your creatinine, the lower your kidney is functioning. So you might experience things like nausea, vomiting, and some chest pain. And then your magnesium was also high, which is indicative of renal disease as well. So you might feel lethargic and have some GI symptoms, again, like nausea, vomiting, stuff like that. And then white blood cell was high as well, and this can implicate like fever. You might have a fever, you might feel fatigue, and this is typically due to like an infection. So you'll have some symptoms of infection. And then your glucose was high as well. So you may experience like fever, excessive thirst, and even fatigue. So we would want to assess like your A1C to see if you have diabetes, because your level being at 130 is indicative of diabetes. And as you can see, you have these two lines and tubes right here. So one of them is a nasal cannula, which just helps get you some oxygen so that you can breathe better. And then you've also got an IV line, which can be for administering your pain medications and also fluids to help you feel better. And I also wanted to talk about DVT, which is deep vein thrombosis, basically a blood clot in your lower leg. So you are in bed a lot, so we want to make sure that we educate you on the signs and symptoms so you can help us monitor for that so we can get that taken care of if it does occur. So it will typically happen in one of your legs, not both of them, and you'll have a lot of swelling in the lower extremity, and then it will be painful. It might even throb. If someone touches your leg down there, it will be painful or tender. It can be red, and it can also feel warm to the touch. So just be on the lookout for that. And Mr. Weasley, it looks like you need a 4-vessel CABG, so it looks like they probably did a coronary angiogram to diagnose that. Just noticed that in your chart. Okay. And some of the medications that you'll probably be given for the high blood pressure is a beta blocker. Again, that just helps to lower the blood pressure and control that. You may also be given an ACE inhibitor, which helps to decrease the fluid in the body, because with a lot of cardiac problems, we get extra buildup of fluid. And that will also help with the blood pressure. And going back to the DVT topic, again, we want you to help monitor for that, but if that does happen, we will get you up for PT, but we just want to make sure you're hemodynamically stable, just meaning that like your blood pressure is good, the MAP that I talked about is good, and that your INR is in a therapeutic range. And that you're also anticoagulated, just meaning that they're going to give you basically a clot buster to help break that clot up. Okay. Sound good?